Today I'd like to talk about meniscus tears in the knee. First of all, what is the meniscus? Well, in the knee there are two different types of cartilage. There's a thin layer of cartilage that actually lines the bone, and that acts like Teflon, just like you have in your cooking pan. And that Teflon layer, or what we call the articular cartilage, allows the knee to bend back and forth nice and smoothly through a full arc of range of motion. The second type of cartilage in the knee is much thicker, and that acts more like a shock absorber in the knee. That way, when you're walking, your thigh bone doesn't hit the shin bone because of that very thick shock absorber. And that is what we call the meniscus. When that meniscus is torn, typically it's painful. And the things that are most painful are things that require you to kneel, bend, squat, turn, or pivot on the knee. And in those situations, that's what we call mechanical symptoms. Meniscus tears in the knee that have mechanical symptoms often require surgical treatment. That surgical treatment is pursued through what we call an arthroscopy. And that's an outpatient procedure where we place two very small poke holes in the front of the knee. And then using a very small camera and small instruments, we're able to go in and treat that meniscus tear. The treatment is very effective, and most patients are back doing all of their normal activities within the space of 2 to 3 months. However, they're back able to do a sedentary job, usually within the first 7 to 10 days.